Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I have with me today Dr. Cathleen London, a family physician in the northern reaches of Maine. She prefers to be called Kat, so I will address her that way during this call. Kat, it's great to be talking with you.
Oh, it's my pleasure.
So, could you tell us about your path to medicine and to family medicine? How did you end up becoming a family doc?
All right, so I'm Jewish, which means I was raised from the womb to be a doctor because we had lawyers in the family. I was actually given that little doctor's medical kit when I was 2, and my brother conned me out of the candy because he said he was sick. And I had that natural interest in biology, so that was an easy one. I went away from it. I had to go try other things, and that was a good thing for me. I needed to be sure it was really what I wanted. So I didn't actually go to medical school until I was 29. I had a career first as a software engineer and also in the film business doing set and costume design. So I definitely took the long and winding path. And I followed my heart. And that, I think, is really what ultimately landed me in family medicine as well. I'm a big believer in really following your heart. I do that with my sons now as they're in college. So I went to medical school thinking I was going to go into OBGYN because I wanted to do primary care for women. And then as I was doing my rotations, number one, I liked everything. So that was kind of clue number one. And number two, OBGYN is a real surgical specialty, and I really wanted the primary care end. So don't get me wrong, I like surgery, but I wanted really that relationship with my patients. So, and I kind of was a little horrified at what I saw happening in the office in some of my GYN rotations. So, and then I had a great, amazing experience on my family medicine rotations, which I did in Hawaii, and that's a really long story, how a Yale med student did her rotations in Hawaii. But I got to do a little of everything and met 3 amazing family physicians who had very different practices, and it opened my eyes to the possibilities. And I chose Oregon for residency so that I would have very strong women's health. I knew I was going to do obstetrics, which I did until about 6 years ago, and I knew I wanted to do C-sections, and I didn't want to have to do a fellowship in order to do that, so I did come out with that privileging. And I initially took a position teaching, which was all great. And Oregon trained me to be a rural doc. So our residency was geared to be both. It was partially out in the boonies and partly tertiary medicine, which was, for me, perfect. It was a real great combination. I mean, that first time I was out in the middle of nowhere and my attending was 20 minutes away. Like, what? But it trained you for when you're done, that you are self-reliant, which is, to me, the definition of a family doc. We know where to look. We know our own limits. We know when we need help. We know just enough about enough things, and we're constantly learning and expanding so that at this point, 21 years in medicine, I am not bored. And that was a lot of it for me. When I was on each rotation, everything was so exciting, like you're doing CT surgery and your hand is on the heart, and how cool is that? And then you start to think what happens after your 9 million years of training. What is your life like? What are you doing every day? The same surgery, and I felt like I was going to feel like a highly trained technician, and I'd be bored to tears. And how much is there to know about 4 valves and a pump? That's not me. You know, I had classmates that needed that they needed to be the expert of the great big left toe. Good for them. I'm really happy for them. That's not me. So you have to know yourself. So for those who are still figuring that out, is that what you want? To me, that's a partialist. That's not me. I don't call them specialists. I call them partialists. And so that's the difference to me. A great family doc are the really smart people. because you got to know it all. And that intimidated a lot of my classmates, actually, at Yale. But they understood why I picked it. People were really surprised when I picked it, but they understood it. I hedged my bets and did put GYN underneath family medicine because I didn't want to not match. So, but for me, it has been I have changed a lot of what I've done. As you mentioned, I'm now in the wilds of Maine, but I didn't start that way. I started out in Boston, so yeah.
So talk about that, how you started out and now how you moved from Boston to New York City, as I understand, before taking off for the woods. So can you tell us a little about that?
Yeah, so out of residency, so when I was married and had both my children in residency, which I don't recommend. Mine was sort of the man makes plans and God laughs. So I got pregnant the day after I signed my contract for residency. It was not planned, really. And then literally the day I stopped breastfeeding my older son, I got pregnant again. You would think as a doctor I would know how that happens. So I spent all 3 years of residency either pregnant or lactating. I was also an Orthodox Jew. So when they tried to tell me that my second son was preterm, I'm like, yeah, no, because here's my call schedule and here's where I went to mikvah, so this is where we had sex. He's exactly 37 weeks. So that was kind of entertaining. Any rate, so here we were with 2 babies, and we were Orthodox, so we wanted a good Jewish community, and you can't do that in the wilds. And neither of us were Orthodox growing up. We were both Jewish, but not religious, so we wanted a good Jewish community. My then husband actually wanted to he actually wanted to go down to Baltimore, and I said, because Baltimore, the Jewish community is in a really not nice section, and I started to imagine coming home from a delivery in the middle of the night and going, no. So when I started looking at where we were going to land, we knew we wanted to come back east because of family, and we kind of centered on Providence and Boston, and I ultimately took a position with BU, who was then just starting to build their family medicine department, and I took a position as faculty. I lasted being just a faculty member and full-time position at BU for about 9 months. 4 of us actually left around the same time. It was not a match for me to be there full-time with them for many, many, many reasons. But I stayed on as faculty and started my own practice in Brookline, which is actually where we were living. And I started my own practice, which was really scary, 9 months out of residency, 10 months out of residency, but was amazing. And I did it. And I built it up. And I did obstetrics, and me, this little Jewish girl, got privileged at a Catholic hospital because that was the one that was in the Jewish community, in the walk-in community, and I was able to talk all the Orthodox Jews into, no, they're not going to kill you, and and it ended up being a really nice relationship, and it was great. I subsequently got divorced, so there was a lot of family pressure to move to New York after that. And I said, no, my husband's there, their father is there, I'm staying put. And I kept teaching for BU. I also was teaching for Tufts because of the other hospital I was at. So I had med students in my practice and would teach first and second years on clinical exam and would have third and fourth years rotate through. I would occasionally lecture residents and go over and talk on different topics. So it was really very rewarding. And I got to a point, now I went through Romney Care, so, the predecessor to the Affordable Care Act, or Obamacare. And the way that came down in Massachusetts, I was either going to have to grow my practice very, very large or be swallowed up and become an employee. And that was all hitting me. And the boys had gotten old enough, my 2 sons, that they wanted to be near extended family who were in New York. And then I got this great offer from Cornell. And pie in the sky, Cornell being one of the orphan schools, the way they were talking to me, it almost sounded like maybe they're going to actually think about starting family medicine. So I went, and with much trepidation about moving to New York, because I'm not a big fan of New York, moved. Closed my practice in Boston, which was heartbreaking. And moved to New York City, which actually I had some patients who had moved to New York, so they were thrilled, and took a position as an employed faculty member. Unfortunately, they talked a good game ahead of time, but then like the dean changed and everything else, and so all that pro-family medicine stuff kind of went away, and it ended up not being what I thought it was going to be, but I did last 5 years there, but really did not like New York City. And saw a lot of things I didn't like my boss and other people didn't take Medicare. How can you be faculty at a medical school and not take Medicare? And some didn't take insurance at all. This is sort of the opposite of me, who believes in single payer. And so I was really at this kind of crisis of, And then I got this, as a doc, you get a lot of spam email. Here's a job offer, here's this, here's that. And this one came across that sounded amazing. And the money was good. And it described kind of what I wanted. So I opened it and I called the guy. And it was for Fort Kent, Maine. And if you look on a map, that's at the very top of Maine before you hit Canada, what we call the Crown of Maine. And that didn't scare me. So I actually had a phone interview, and it went really well. I told my boys about it, and they were old enough. They were about to, the older one was starting college. We all went off, this is now 2 years ago, and flew up there, land there in the middle of a snowstorm in this tiny little plane, drive up to Fort Kent from where we had landed in Presque Isle. The boys see the snowmobiles going 100 miles an hour, and they're like, yeah! We passed territories, unorganized territories. I had no idea the U.S. still had those. And we're like, oh, my God, I'm home. And loved it. Had an amazing experience. But as they usually do, the recruiter kind of lied. They needed somebody immediately, and I couldn't just abandon my patients. I was thinking, this was February, I was thinking I'd start the following September, and that wasn't going to work. And I said to my sons, they're going to pick the guy who can start right away, even though he's not experienced, and I was right. But that made me explore what else is out there. And what it made me realize is I really wanted to be a rural family doc, so I looked at upstate New York, New Hampshire, Vermont, and Maine, and kind of quickly settled on Maine. I really recognized that I wanted to be in an underserved area. I wanted to be rural, but I also wanted to be on the water. I've always been an ocean girl, and that's where I am. I'm in a town called Millbridge. For those of you who are not savvy of where that is, if you know where Bar Harbor is, keep going up the coast for about another hour, and you'll find me. I'm in the middle of where all your lobster comes from, and the Maine blueberries. It is very poor, very rural, very underserved, very high on insurance, and we have this huge opioid epidemic, which, I know the whole country does, but we're really hard hit. And I was shocked. Here I've come from major cities, which you think of cities and narcotics. I never saw anything like what I saw when I got here. And the past year and a half, I started my own practice a year ago. I had initially come up with a position. That CEO left right before I got here, so the interim didn't want to pay the money that I was promised, and so 6 weeks later I found myself having to look. Was at an FQHC for 4 months, and then turned around and started my own practice. And I'm in this old Victorian that I rehabbed in the middle of town, and it's amazing. I'm loving it. It has its challenges, like everywhere. There is nothing that you're going to do when you're done with training in school that isn't going to have its challenges. Some that I didn't expect. You go to an underserved area, you figure people will be grateful. Well, some of them are, and some of them are like, who are you? You're not from here. And there was a lot of that. I didn't expect that. I really, really didn't. But little by little, they're starting to be okay about it, and more of them are coming around to realize, oh, she's staying, and maybe she's not so bad. So it's been a really interesting time. And in the meantime, I've got my place on the ocean that my dogs can run around on, so I have the life that I want as well. I'm continuing to do advocacy work that I have done my whole career. So I got involved in the Family Academy of Family Medicine and or state academies, whether in Massachusetts or New York or now here in Maine, legislative committees and everything else, where I go testify at the State House or testify and knock on legislators' doors in D.C. And I'm continuing to do that here at the state level. And I think that's really important. I think it's important that we have a voice for our patients, because they don't. So I'm keeping busy.
Yes, I think very busy, and very you feel very challenged from what you're describing. Now, you and I met at the Direct Primary Care Summit 2016, and I'm wondering if you can comment on your perception of the value of the direct primary care model for you as a practicing family doc setting up a practice.
So let's start that I do believe in single payer, so I'm a little different than some of the other direct primary care docs, and I run what is called a hybrid practice. So, because I will always take Medicare and Medicaid. I do, in Maine, is one of the poorest paying in terms of Medicaid, so I do lose money on those patients. And I take some private insurers, not all of them. I have very famously written some letters about some of them. I had the op-ed that is currently going viral that I wrote back in November. I talk about my experience with Aetna and my experience with Martin's Point. So I am not contracted with either of those. I am, however, contracted with Anthem and some of the others. But I have so many uninsured patients because the state did not do Medicaid expansion. And then the lobstermen are loath to do that kind of they don't want to spend the money, but they have it there and they don't get it. So direct primary care is where I'm gone for all that uninsured. So for a monthly fee, they get everything. And where I am located, we're 45 minutes from the nearest hospital. So I do a lot of urgent care as well. So they love it. And I have a pharmacy, so that's actually helped some of my insured patients as well because of these huge deductibles they have. Because I get medications at cost. So most of the meds are $5 a month. And then some of them, our pharmacy here in town is not open evenings or weekends. So when they need a Z-Pak, because I've diagnosed them on Saturday or in the evening, with pneumonia, and I've got it for $5, they're going to pay me the $5 because they've got it right here, So it's a convenience thing as well. They're thrilled. I just had a guy come in 2 weeks ago who had previously been on antihypertensives, had been lost to follow-up for various reasons, partly because doctors don't stay in this community because all of them are employed and administrators here are not known to be the best, amongst other things. And so he got tired. That was one of the issues and everything else. But he was working with, actually, my contractor, who is also a patient of mine in direct primary care, the contractor who had actually built the house I live in and did the work on my office building. And he wasn't feeling so good, and they said, go over to Dr. London, she'll fix you up. And so I brought him in, and we first were able to reassure him about some of the things. He on his own had actually figured out that part of it was a med he got put on, and it was a side effect. And I was able to say, yeah, this is the part of it, and you have an allergy to X. And then we got his pressure under control. So he paid the first 3 months of his direct primary care, came back for a couple other visits, and after his next visit, he went to go pay something, and we're like, you don't owe anything. He's like, really? He was so excited. So the concept is really catching on because it's not expensive for him. He's paying, and I have somebody else who, again, through another patient who I think is actually insured, heard via the grapevine that he could pay a fee and I'd be his doctor. He came and signed up him and his wife, and that guy is a vet, so he's totally covered by the VA, but wants a doctor here in town. So it's catching on. They see the value. And until this country can get it together and not do this horrendous cost shifting to patients, I look at, my own insurance, the best I could do here in Maine, it's very different than Massachusetts and New York that created their own exchanges. Maine has a small population. It's 1 million altogether, an elderly population and sick population. The best I could do was $900 a month for me and the boys, and each of us has a $6,000 deductible. I'm like, great, I'm paying this huge amount for catastrophic coverage. It's crazy.
Thank you for that. So I'm wondering if you could offer advice You've clearly, I mean, they should be doing a TV series or a movie about you, quite honestly. Be a lot more interesting than some of the medical stuff that's out there. But could you comment for others who are, at an earlier stage of their career decision making, your recommendations as they're trying to do?
Don't be afraid to go do it. You don't have to go take a job. So that's my number one. You don't have to go take a job working for someone. That's the beauty. You can still go open your own practice. And there's a couple ways if you don't have funding to go start yourself up, people will loan you money when you're a doc. And I understand you're coming out in debt. I get that. So direct primary care takes time to build up. You can also do what I'm doing and be hybrid. You can part-time do shifts other places. You can do locums work to get as you're building up. There's other ways of doing it. You don't have to go take a job somewhere and be miserable and have people telling you how you have to practice and count you as a cog and here, what's your productivity? Don't be miserable. That's my bottom line. Follow your instincts. They're good. And my testimony is going to be tomorrow at the single payer bill. Part of what I'm saying is we went to med school to learn how to diagnose and treat disease and hopefully to prevent it. We didn't go to spend our time fighting with insurance companies when we know something's right because it doesn't fit their little box of what an MRI is for. It just doesn't make sense. To spend two-thirds of our time on administration and nonsense. Each prior authorization for a medication takes me about a half an hour because every insurance company is different. I'm to a point where if it's for a generic med, which a lot of them are, I won't do it because I have them for $5 or less a month. So no, if it's that cheap, you're coming and getting it here. I will not do it. Period.
Great. Thank you very much for talking with me today. And I'm going to sign off here and wish you well with your endeavors. With this message that goes out, we'll have your name and email address if you're comfortable sharing that with people. And
absolutely, yeah.
And they may follow up with you. So, Dr. London, thank you very much for talking today.
Oh, it's my pleasure. Anytime.